To other stories, the World Health Organization has ranked Ghana amongst a group of 29 countries, accounting for the highest number of malaria cases globally. In the latest World Malaria Report, the World Health Organization says there was a 2 million surge in malaria cases from 245 million in 2020, resulting in an estimated 247 million malaria cases in 2021 in 84 malaria endemic countries. The report stressed that 95% of the increase in cases are coming from Ghana and other countries in the African region. Dr. Dorothy Achu, team lead for tropical and vector-borne diseases in charge of World Health Organization African region, she gave a breakdown of the report. So, the doctor
most affected, carrying the highest burden. But we have hopes, and the Director General of WHO, Dr. Tedros, mentioned this in the report by saying that although we face many challenges, and I quote, there are many reasons for hope by strengthening the response, understanding and mitigating the risks, building resilience, and accelerating research. There is every reason to dream of a malaria-free future. And I quote, many countries are already beginning to see their country eliminating malaria as a result of resilience to the situation. Looking at the African region, we notice that from the 247 million malaria cases that were registered globally, 234 million are in Africa. And again, we registered 593,000 deaths. These are enormous numbers. And if we look at it very keenly again, 80% of these are in children under 5 years of age. And this is compared to 91% in 2000. On the left hand, you can see that in 2021, there were 84 malaria endemic countries globally, covering several continents. But this global distribution of illness, of this disease, is masking real disparities among the countries. So the countries have different distributions of illness. And the pie chart, which you can see, shows us the disparities in the distribution of malaria burden. Summarily, although Africa is bearing the highest burden of disease, they are also making the highest efforts in averting cases and deaths. So let us focus a little bit on the high burden countries. We have 11 high burden countries, 10 in Africa and 1 in Asia, which is India. So these high burden countries, as we see, there were also increases in incidence, as we can expect. But we also noticed that even those high burden countries, there was a great reduction in the number of deaths. And the countries that really contributed in reducing the deaths were DRC, Ghana, India, Niger, and Tanzania.
My colleague Blessed Soga monitored the conference as the report was released and joins me live on Zoom with more. Blessed, what more do we know of this report?
Well, Bray, so globally, the World Health Organization is reporting that there were an estimated 247 million malaria cases in 2021 alone in some 84 malaria endemic countries. And the indication we're getting is that this is about a surge of 2 million cases from what was recorded in 2020. So in 2020, actual number of cases were ranging somewhere around 245 million. That was the range for 2020, but it shot up to 247 million in terms of the number of cases in 2021. So what you have on the screens right now is a picture of the number of countries that are marked red most of them in sub-Saharan Africa, accounting for the highest number of cases. What's significant is that the World Health Organization is indicating that the countries which are recording most of these high numbers are accounting for 95% of all of the 247 million malaria cases, which means that Ghana is amongst one of these 11 endemic countries, accounting for that surge in the figures as you see on the screens there. So that's our global position in terms of how we're doing. Beyond us as well, the World Health Organization is pointing out that we're having some deficiencies in terms of our surveillance. They are pointing out that we're not adopting some of the toolkits and digital frameworks that have been put up in terms of reporting cases. So as of 2021, 2022, it appears that the World Health Organization is flagging us for still relying on paperwork in terms of reporting when it comes to, tracking down our malaria cases. So these are some of the frameworks, issues pointed out in this document, which the belief is that authorities will be able to track down these cases and to, of course, scale up the response towards this. Beyond that as well, there's the issue about COVID-19 pandemic. The pandemic appears to have been causing some disruptions as well in what's happening in terms of our fight against malaria. But this appears to be a perennial problem for Ghana because, mind you, our cases were expected to have come down. But looking at what the trend is, the cases appear to be going up, except to say that for Ghana, we've been spared, if I could use that word, in terms of death rate. We've been able to reduce the number of deaths from malaria infections, and that's a plus that the World Health Organization is giving us.
Thank you very much, Blessed Soga is my colleague here at Joy News Now. Dr. Kezia Maum is the manager of Ghana's Malaria Control Program, and she joins us live with more. Thank you very much, Doc Maum, for your time. Why are we still recording high cases of malaria after all these years of advocacy?
Thank you very much for having me, and good morning to your listeners. Yes, indeed, we are one of the 11 countries which accounts for the highest global malaria burden. But I just want to point out that from the report, we are one of the few countries that have been able to meet the target set for 2020. The few countries that have been able to reduce our morbidity and mortality in the region. So despite the fact that we are in the 11, there is progress. In fact, if you look at the previous report, we're contributing about 4% of the world burden. In the latest report, we are contributing about 2.2%. We still continue to observe high numbers. One, due to our climatic conditions. Two, due to the fact that we haven't been able to scale up optimally all the tools. Three, even with the scale up of the tools, there is the requirement of the behavior change for people to use these interventions for us to experience the maximum impact of these interventions. So there is progress, but there's still more work to do. And so even with the report, I'm quite happy that as a country, we are trying to be more ambitious and moving towards elimination. So it just shows that when we put our hands to the wheel, we will make some progress.
So, significant that we've jumped from 4% to some 2% in terms of our contribution to the whole prevalence. But would we say that is how much we have achieved over the 10 years in our fight against malaria, or there's more?
So when you're talking about 10 years, there's more. So this latest one was looking more at the global, whether we've achieved the global technical strategy, which was set in 2015. So we are talking about a 5-year progress. In terms of 10 years, if you take like 2010, I think we were recording at our health facilities, we were recording deaths in thousands. Last year, our deaths that we recorded for malaria was around 275. So when it comes to malaria deaths, I can say that we've reduced them by over 75%. We indeed still are grappled with high numbers of disease due to malaria, and that's where we need to work more. So we haven't been able to achieve that much as we have achieved with the deaths. So people are not dying from malaria as we used to see in the past, but people are still getting sick from malaria. So we haven't achieved 75% reduction for the disease, and there's still more work to be done for us to be able to do that.
So once there's more work to be done, what are we doing differently to change the narrative?
So what we intend to do, and I'm sure in the course of 2023, we will come up with a national malaria elimination strategy that would be publicized. We are working on it, but what we intend to do is to zone the country into areas with low transmission, medium transmission, high transmission. In addition to what we are already doing, we are going to enhance our surveillance, especially in the low transmission areas, and look for additional tools that WHO is coming up, innovative tools to drive down the transmission further, so that at least we can move the low transmission areas closer towards elimination, whilst we continue to scale up our interventions in the other areas. So we hope that in the course of 2023, usually likely to be around World Malaria Day, you would see a new strategy in our fight against malaria.
How would that entail digitalizing the effort? Because we had the World Health Organization mentioning that it looks like we are not using the digital platforms to report malaria cases. How will that be part of the new strategy?
So it will interest you to know that Ghana is one of the countries that's doing very well in terms of digitalization of our health data. In fact, all the health facilities through the districts and the regions report through an electronic health information system. What we haven't done nationwide is the transactional data, where every case when you come, it goes into the digital system and automatically goes into the bigger health information system. So what goes into the health information system is the aggregated data. But we've started quite a number of health facilities, quite a number of regions are now entering transactional data. Yes, it's not optimum. It's not at where we want to get to. But if you look at our progress over the years, we have really improved. And in fact, for malaria program, almost all the interventions that we do on the field, we do real-time digital data collection. When we are distributing nets, when we are doing giving drugs to children for seasonal malaria chemo prevention, right from the community volunteer is digitalized. So we don't do paper transactions for that. But Ghana is one of the countries in Africa that is far advanced in digitalizing our health information system. Transactional data is being digitalized. It's not everywhere in the country, but we've made a lot of progress.
Okay.
So with the low malaria transmission, in fact, all the health facilities in that region will be doing transactional data, because what will happen is once you get malaria, somebody reports to malaria, we need to know as quickly as possible so we can react to prevent further transmission of that malaria. So that will be one area that will strengthen even more in making sure that surveillance is more electronic and more real-time in the areas where we'll be having low malaria transmission.
With this whole distribution of net, some people take them, they don't use them. What has been our monitoring system in that regard, and how can we change it to ensure that probably, those who are taking it are in fact using them, or we are changing the strategy after all?
Yes, we have a challenge where people take the net. Some people take the net and don't use it. So if you look at our data, the last study we did in 2019, we had about 50% of people using the net, whilst the others don't use the net. We do monitor, we do continuous surveys. When we do ask pregnant women, when they come for antenatal, when people come to the health facility, especially if they come down with malaria, to try and find out whether they have the nets and they are using the nets. We also continue to use our BCC tools, working through the media. So when I say BCC, I mean communication tools, using the media to try and encourage people to sleep in the nets. But what we are doing is to put in other interventions. So in addition to the nets, we have what we call the larval source management, which is taking care of the mosquitoes in the baby form, even before
Okay.
they get to baby, they
All
get
right.
to adults. The breeding sites of the mosquitoes, we try to destroy the mosquitoes within.
Okay.
And we hope that some new tools will be coming up. It's in the early stage yet, but to manage the outdoor transmission so that when people sit out for late, they know what to do to prevent being bitten by mosquitoes. But
Okay.
we continue to ask people, if you have the nets, when you go in, please sleep under them because they are effective.
Okay, thank you very much, Doc, for your time here. Now.